I moved to, just give a brief introduction about myself. Um, I got married and I moved to the United States in 2019, and then from there I moved to Canada in 2021. And since then, I first initially was thinking to actually apply in Canada first, but then as I was applying, I just wanted to expand my options. So I simultaneously started applying in the United States as well. So so a majority of my experience actually lies in Canada and not much in the United States because I just moved to the United States about like 4 months just before COVID. So because of that, I couldn't get a lot of information over, get a lot of experience over there. So um, now I completed my Bachelor's of Dental Surgery from Campani Institute of Dental Sciences in 2015. And then right after that, I did my master's in hospital management from Administrative Staff College of India. So I worked as a dentist both part-time and full-time in my professor's clinic for about 3.5 years. And and I was doing this while I was pursuing my master's. So my daily drill used to go on like in the morning, I used to go to business school in the morning, attend summer internships, complete my assignments, complete public health projects and everything, and then come back in the evening, work until work from 6:30 to 9:30 in my professor's clinic, and then go back home. So this went on for about um, in total about like 3.5 years. I got placed in a health IT company as well, and I worked for about 10 months. Even after I got a job, I used to work in the health IT company in the morning, and I used to come back to my clinic and work as a dentist in the evening. So my work was, I'm a workaholic. I love to work, and my I can work straight for about 12 to 13 hours, and that has been my journey. And just a week before my wedding, I just quit my clinic. And then right after that, in 2019, I moved to the United States. And probably that was the only time when I actually didn't work for about a year and a half. And me and my husband, we decided to move to Canada as permanent residents and just start my journey over there. Because as a dependent in the United States, I couldn't work and gather much of an experience. So then I went to Canada, and within 2 months, I got a job as a dental assistant and a front desk receptionist. So that is that is a place where I'm still working right now. And I should really thank all my stars. Wherever I worked, the staff and everyone were very kind and very supportive. And they taught me a lot at every step. Um, so many things because the way dentistry is practiced in India and the way dentistry is in North America is very different. They've been very patient with me throughout the process as well. Whenever I needed breaks, they gave it to me. And I'm very thankful for that. I shadowed a dentist as well. In the meantime, on and off, I used to go once a week. And then apart from that, I also volunteered in an organization called Certified Listener Society as a chat responder in Canada itself and also in the local municipality over here. I worked as a vaccination volunteer. And apart from that, I did my bench test preparation course in University of Buffalo, a month um, preceptorship for a month in Boston University. And actually, apart from this, I didn't do anything else in the United States. So anything else, whatever is there in my CV is actually from Canada itself. I also shadowed at a dental lab for about 2.5 months, and I do have some experience in research as well. And so this is all the rosy part of my profile. So here comes the negative part of my profile as well. I want to share both positive and negative over here. So I did not clear my NBD in my first attempt. I lost it by 1 percentile, and it was probably the most crushing moment I ever had. Probably I've cried near Flynn 100 times, I think, about it. And as usual, Flynn is being Flynn. So she has always supported me, always. And even in late nights or whenever it is, she used to call me because all this experience I gathered was to mask that attempt. I immediately cleared it within 2 months. So just when I got that 74, I don't know why the INBD actually they decided to change it that the second attempt has to be after 2 months and not 3 months. And and I cleared it in 2 months. In like 2 months, I just sat down and I just wrote it immediately. And that was probably one of the most crushing moments ever for me. But I just decided to rise up from there, no matter what, because the love and passion for this profession is definitely much more than that failure for me. So I decided to, and my husband and my family, my professors, my workplace, actually everyone supported me over here. And they were like, you can do it. And that just helped me a lot. And right after that, I started applying to schools. So my first cycle was in 2022. I applied very late, but I did that because I wanted to actually test the waters to just see what it is like. And I know that I'm not going to get a single invite. I know that I'm not going to get anything over there, but I wanted to get the experience out of it. The experience of actually everyone mentioning about supplemental applications and about deadlines and everything. So the first cycle, that cycle went by that way, and yeah, you cannot count that as a cycle as such, but yeah, it is something which I learned from. And in 2023, that's when I actually associated myself with Caapid Simplified, and I took the scholarship program and everything. So that's when I met Lynn for the first time. So and we had a call. I had a call with Karthik as well. So that year, I what happened was there was no issue. Everything was actually set and everything, but I had the biggest issue I had was with the letter of recommendation from my principal. It delayed by about 2 months because of some internal issue over there they had, and because of which they couldn't grant me an LOR. That was probably the most difficult moment I ever had again in that year. And again, I was in a situation where I applied to all the schools in June, July, and and I ended up sending some of the most important schools which needed to be sent in April by June. So that was another reason. But what happened was, I don't know. Um, I actually had a call with Karthik just before I was actually finishing up with my applications, and I really wanted to apply to Michigan, but I was really scared because I knew that I was already late. But then Karthik helped me out and he pushed me to just apply and apply to Michigan. I'm not sure why I did that though, and that landed me in an invite in 2023. That was something which I least expected at that moment because of many circumstances over there. But I'm always thankful for that. And I learned a very important lesson at that time that I shouldn't decide whether I'm worth enough to actually apply for university or not. But because I should let the university decide it, I shouldn't decide it whether, you know, I'm worth for a university or not. Just give me 1 second, please. I'll be off for 1 second. Just give me 1 second.
In a way, I'm glad that Harika is like explaining in detail, because then you sort of get to see her pain points and the, like she said, the rosy parts as well. And I think there was a question that came to us about Canadian experience. So I think she sort of answered that, through her with her story. I think a couple of people asked whether Canadian experience counts, right? And whether not having experience in the US is okay and Canadian experience counts. So Harika is one of the many people that do apply with Canadian experience. So I want to reassure whoever that is and whoever's watching later that Canadian experience is equivalent to US experience. Let's sort of put it in a ladder, like hierarchy. Anything in the US is on top, right on top, any day, right? Whatever you do, your practice, dental assisting, uh, community service, anything, research. But then the next best option is Canada, 100%. Because it's a North American experience, a lot of things are similar, the community is similar, the protocols and all that, if even if not the same, very much similar than what you would have done in your home country, etc. Third best thing would probably be another country for you, like not your home country, not the US, not Canada, but another country. A lot of people work in the Gulf, right? I know people with 25 years of experience or so who are already working in the Gulf, and then they want to go to the US and make a like change. So that way you sort of have experience in your home country, then you have experience in another country altogether. So sort of diversity there in terms of experience in patient management. Then you come to the US. And the last one in the tier is obviously your home country experience. So aim for the US, experience the US. But if you can't, please don't beat yourself up about it. It's okay. Not everyone can travel, not everyone can be there, and they will understand that. They will actually look at it through the lens of your visa status. So if you're someone who has a residential status in the US, imagine you're a dependent spouse or a student or something like that, and you're residing in the US, then you should try and get more experience in the US. But if you're someone who does not have a US visa, you have a visitor's visa, you're not in the country, then even 1 month or 2 months or whatever little bits that you have will count for more. But if you're staying in the country and you don't have much experience, then you probably should work on bringing that out more. Did any of you all have questions about Canada? Who's here right now? Anyone who wants to unmute and speak
Yeah,
about it?
I
Yeah.
actually have a question. I want her to talk about her volunteering experience in Canada more. I didn't quite catch what she did.
Okay, I think I let her answer once she's back. But I remember one thing is she's done an online volunteering experience, which again, a lot of people come and ask us whether it's okay to do online, stints. So again, in person is always better. But if online is what you get, that also makes a difference. She was a listener, I think, or first responder in terms of conversations. Like I think when people need to talk to someone, be online and chat with them and help them come out of whatever they're feeling. That was one. And then she also said that in the local municipality, she volunteered as a vaccination coordinator. Yes, Harika's here. So I think that was a second answer. Which again, the takeaway for y'all should be that a lot of people ask me, is it okay if I go to the municipality, Flynn? Is it okay if I'm, with a small volunteering experience? Nothing is small. The best thing to do is to walk into a soup kitchen and serve food, or go to an orphanage in your locality. Something non-dental also works, which is very small in your locality, because if it's in your locality, then you can go there every day. And when you go there every day is when you compile on your hours. So that's that. And before Harika continues the story, Husna, you also can unmute and ask your question about the Canadian experience. We can't hear you, Husna, because your audio is on mute.
Am I audible now?
Yes, you
Yes.
are.
Right.
Yeah. Hi, Harika, and hi, Flynn. Flynn, I don't know if you remember me. We already had conversation over a call, like a week or two back. So I had the same questions that Dr. Harika is going to answer today. So I'm very
Okay.
excited and
Yes.
looking forward because I'm one of the applicants who will be applying to Michigan this year. So I'm very hopeful,
Awesome.
like
You're in the
as
right place then.
yeah.
Okay.
And there are some questions that I wanted to ask, which Dr. Murali has already asked and you have answered. But then I still want to ask a few questions. I don't know if Dr. Harika has covered it. Dr. Harika, I wanted to ask, what is a good GPA to apply in University of Michigan, particularly? And did you apply through the ADAT score or just INBDE? Because nowadays they're accepting ADAT too, and that has become quite very challenging. ADAT
So,
is not an easy exam, honestly.
yeah. So firstly, hi guys. I have to apologize for my attire. I'm actually coming back from a Christmas party. That is the reason why I got this delayed, and I apologize for my attire as well. So this is the reason. And so coming to Husna, so um, for any university, it's not just Michigan, but for any university, if you are able to meet the minimum criteria, that should be enough for you. Because the reason is, now when we look at the profiles, they are not every profile in any university invitation pool was not uniform. It really was not uniform. And they clearly, I could clearly see that the universities are not looking for something like that, because they want a varied profile. So Michigan, a lot of them had this notion that Michigan will not call freshers, and they want only experienced people. They want only with people with masters and very high GPA, or like research experience or anything like that. But that wasn't the case. So as I was telling you, so last year 2023, um, I already told you that Michigan was the very last application. Like, sorry, I was already very late by my application. You will not believe Michigan was the last school I applied last year, because I was so scared to apply for that school. It was something which I really wanted so much, but at the same time, I was very scared. And Karthik was like, no, you don't decide whether you are fit for the school or not. Let the university decide it. And I just applied it in a zap. I do not know why did I do it, but that gave me, like, I couldn't believe when I got the invitation last year. I'll be very honest with you. So, but I was very grateful for the experience I had, and because the professors are so warm, the like everyone in the university, they welcomed us like so warmly. I can never forget that. That was etched in my memory for at least about 6 to 8 months with me. I cannot forget that. Because I went to Boston, I went to Buffalo, and I've met some students with their experiences and everything. I'm not saying that the others are bad or something, but probably this, and it can also be like it's the first in-person interview for me, so it was something that just caught with me. So there is no set criteria for any university, unfortunately. That is one thing which I will not be able to answer for you, because that's why you keep seeing randomly in the CAAPID groups and everything that someone with 2.78 GPA gets an invitation to University of Pennsylvania. You'll be seeing someone with 3.02, someone getting an invitation to some high-end university. So there is no set criteria. And coming to ADAT as well, yes, I applied with ADAT. I did apply with ADAT. But there are many people who applied without ADAT and they got in. It depends on each person's profile. Now coming to my stats, I did not mention any of my stats. So my GPA is 3.4. And then I have my ADAT score. I have two ADAT scores. I have an ADAT score of 470, and I have another score of 510. So the first time when I got an invitation, I got it with 470 itself. I know another person who got an acceptance with 470 as well at that time. So ADAT score is really not the criteria, in my opinion, for a person to get an invitation. I know people with definitely higher scores who did not. So there's nothing like, unfortunately, that is why, in like, no matter what, for any university, there is no template. No one will be able to answer. That is why it might look very random or very haphazard, when even in Facebook groups, if they say that, they can call anyone they want, they can call like at any stats they want, or whatever it is, it's totally up to them. And yes, it is definitely the most frustrating part, but it is a part of the process, I think. Because now imagine someone, like, if you are at the front desk and you have 1600 applications put on your face, what will you do? What will you do? Now you cannot say that someone with 3 GPA is excellent or is like really bad, and someone with 3.8 GPA is excellent, because you don't know the story. You don't know, someone with 3 GPA might actually be having some going through something in their life, and after that they might be working in places with which they must have gained much more clinical experience than that 3.8 GPA person. Stats are not everything. That is something which I understood throughout this process.
I love that you said you mentioned your score as well, because I think, and you have two scores. And the
Of
funny
course,
thing is,
they know it. The film knows
yeah,
everything.
they know they know both. I mean, they also know both the scores. And the funny thing is, the perceived good score is nowhere close to that.
It's
It's actually
not there.
580 or something. It's way above. But
I tell
Harika got invitation twice, and the others are the people, like she said, who've not written ADAT. So Husna, for you and the others,
there
couple
are
of
people.
people have asked this. So yeah, you can basically anything that you do is an add-on. So which is why people do
Yes,
ADAT. So that's
yes,
great.
that's all. That's
Yeah,
all.
that's
It's
all.
just an add-on. You are just basically trying to show the university that, yeah, so that I am doing whatever I can. That's all. But it doesn't necessarily mean that, it is totally up to them what they see in you and what they see as a profile and everything. And that is a number one reason why you should never compare yourself with others. It's the number one reason why. So now when you look at, like, profiles which actually get invitations in the group, like like any university that comes in, you might be seeing a lot of them coming with varied experiences. You might be, sometimes when you look at them, you'll be like, oh my god, I have much better experience than them. I have much better scores than them. I have done so much better than them. Some of them have written even books. I know some people have written books as well, authors as well. Oh my god. But your time will come. Your time will come. Just be patient and just be consistent. That is the only thing I will say. It's very difficult. My heart goes out to reapplicants. My heart really goes out to reapplicants more than anyone else. More than the first time applications, it is to the reapplicants to whom my heart actually goes out to. It's not easy, but it's not impossible either. That's all. The stats, don't compare yourself with others. The number one thing which I would say when someone posts their profile in WhatsApp group is, what is it that they have done that I didn't do, and what is it that I can just simply add on to my profile. That is something which I used to do, because I try to do everything I can, and something is there which they are missing out, which I'm missing out. So I want to ensure that I cover that part as well and learn that. It needn't necessarily be that it should be just adding to the profile for the sake of it. If I always took it as a way to learn things as well, be it my preceptorship in Boston, be it working in my dental office or anything like that, I learned a ton in my preceptorship program. Oh my god. So yeah, two of them are raising their hands. Yeah, Husna, yes, please go ahead.
Thank you so much, Doctor. That was quite. I absorbed everything what you told earlier. It's quite motivating as well as We are in state of anxiety too, applying as first applicants. So I want to ask you a question. Like, as per your experience, you have had immense experience in Canada and USA as well, right?
USA, it's not that much, I'll be very honest. One was preceptorship program in Boston, and the other was bench test preparation course in Buffalo. But these two experiences actually prepared me to be a student again. Now I'm going back to school after 10 years. Now it's not a small thing. Some of them might be going after much more longer time than I did. Some of them just right after school. So getting into that mindset was very important, and that was a very big reason why I took up those two programs in my as a part of my experience as well. It was purely for learning because I want to understand what will be expected out of me as a student. What is the drill that I might have to go through morning and evening? And like, see, sometimes you might be just looking at ethical questions in your INBD, saying that you're not supposed to treat a patient when the professor is not around. But when you do it in the practical scenario, it's way more different, and like, it is difficult sometimes. You might see, and that too, now you're going as a dentist, and you know that the patient might require that, but no, you can't do it. You don't have the professor around. You can't touch the patient. You cannot do anything without their permission. So those are the times when you have to hold yourself off, and you cannot go and just perform the treatment like you want to. So these are the things which you will actually learn, which I learned as a student, and which I learned as preceptor over there, or as an observer over there. I purely learned, and my Buffalo bench test preparation course was amazing as well. It actually opened to actually teach me, like, what is the criteria with which, how detail oriented the professors can be, and how tricky the bench test can be as well, and how important is it as well, and the standard they have actually set, because of which we are actually going through this accredited program. So I didn't just want to put it on my CV. I wanted to learn as well. So that's how I took it. And these two were the only experiences I had, I think I must say, in the United States. The rest, everything is in Canada.
Can I just take a minute here to talk about how Harika is stressing on how you need to do something because you want to do it. And I know right now when you're on this side without invitations, it sounds silly because you're like, I'll do anything for the sake of it, and I'll do anything for the CV to get an invitation. But what she says is really important. Whatever experience you do, even if it's a community service, try to really want to do it. Try to feel it. Like, I remember when she was doing that online course, online support, right? Even though she was doubtful, I remember her wanting to do it. Whatever time she was giving to that person while talking, she wanted to do it. And that really makes a difference when you create your application. So what I'm saying now will make more sense once you have gotten through, which is why I'm trying to tell you that beforehand, like proactively. But whatever you go for, a preceptorship, yeah, part of the reason is because you want it on the CV, no doubt. But really live the experience, feel it, note down things that you see, note them down so you can bring that to your application later. So I like that she mentioned it. This is very important. And yeah, we can go to the next question, right?
Yeah,
Harshita.
Harshita. I'm so
Can,
sorry to hear it, Harshita.
unmute and speak.
Harika, first of all, congratulations for your admission to Michigan because I know it's tough and you got through, so that's amazing. Harika, my question to you is, since you did the Buffalo bench exam preparation, did that help you for Michigan as well? Was it similar or like was it different?
It got me into the mode, if you
Okay.
that's the
Yeah.
way, if I can put it. It got me
Mm-hmm.
into the mode of, just sitting down with typhodonts again, because my experience with Buffalo bench test preparation course was very weird, because I actually held the high speed handpiece directly in University of Buffalo. What happened
Okay.
after 3-4 years of gap?
Mm-hmm.
So what happened was, I just ordered my bench test preparation course material to my house, and it got delivered in my house on the day when I was on the first day of that preparation course. So
Okay.
I did not have the experience of the drill or anything. I was panicking really bad. But
Oh,
yeah, that those 5 days over there, that actually helped me to get into the zone of going back, and then going back to typhodonts. Because when did I actually go back to doing my typhodonts? It was in 2011 or 2012, I think. After 2011 or 2012, again I started doing it on a typhodont in 2021. So
So the actual preparation for the Michigan bench exam you did after your interview was done and you got an invite for the bench. Is that right?
no, 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 it's nothing to do with
Okay.
Michigan. I'm just talking about Buffalo. I'm just talking
Okay.
about my experience in Buffalo.
Oh,
So,
okay.
yeah, if you ask me if it helped, so yes, it did get me into the zone of going back to the typhodons and going back to actually having the ideal preparations, and because having an ideal preparation on a typhodont and doing it on a natural tooth is definitely very, very different. And
Right.
that is something which Buffalo taught me, and it helped me to understand where and when am I doing my mistakes and everything at that moment. And it just I think the best way to put it in is it just got me back to being a student again, and just getting into the zone of like I have to take my bench tests very, very seriously, and it's not definitely that easy as one can actually think. That is the biggest thing I could actually learn from the universe, from that experience. And the professors and everyone were amazing, and I made some really great friends over there, and with whom I'm still in contact with. So
Okay.
yeah,
And since you moved to Canada, like, did you start with the Canadian dental process as well?
I initially started it, but then I expanded my options and I fully went on with the US, with only the US itself.
Okay. And just for more clarity on bench, like once you got an invite, how did you prepare for the Michigan bench exam?
I so as actually I want to continue this. So 2023, I had my bench test, everything. When I got the invite, I just started preparing on the typhodon teeth I had at that time, but I was definitely not very perfect at it. So that was the biggest. So once, of course, I did not get through the interview last year. So the biggest takeaway from there was that I have to improve on my interview skills and my bench test skills, and that was the only thing which was on my mind right after that, because that was probably the nearest experience, the first experience I had ever in a bench, and then that actually gave me the biggest reality check. Because
Mm-hmm.
in Buffalo it was where I was training with everyone, but this is I'm competing with everyone over here. So that's a very different zone. And the first bench for anyone and everyone teaches a lot, and probably it gives the biggest reality check. And I think probably I loved it. I loved it that yeah, I didn't do well. It's fine. But I loved it that I could learn so much from it. I
Mm-hmm.
could get up from it. I am that person who actually gets up from wherever I'm thrown down. So I will always get up. That is one thing for sure. But yeah, it was from then I just had only one goal: to just get my class twos perfect, get my PFM perfect. That's all.
Uh,
And
so
that's all
yeah.
for
So for that, did you join any course or was it like at a home setup or something like
It
that?
was only at a home setup, and I was showing my doctors. I told you, right? I had an ex. My doctors in my office were someone who were very supporting and very, very motivating. I used to show my preparations to them, and
Mm-hmm.
they are excellent doctors. I mean, they're someone who can actually open their own institutes actually. So they critiqued properly, like probably like the doctor professors, I think. And then that's all. They helped me get to that stage. Yeah,
Okay.
it's
That's
my professors help, my doctors helped me in my case. That was the situation, because Now I just want to continue where I left. So in 2023, that Michigan didn't go through. So the this period of between November to March. So my
Mhm.
rejection came on September 27th, 2023. So I think somewhat like that. So it was the last week of September, and right after that, Colorado opened. So Colorado opened. I just channeled my energy to that side. I started taking my. I didn't. I didn't want to keep my mind on this, so I immediately started taking Casper. I started preparing for Casper, and I gave it.
Okay.
Got third quartile, and right after that, um, I applied to Colorado University, and after that, my number one goal was so in CAPID application. So for especially for reapplicants, there's always a box which shows what did you improve from last cycle.
Mm-hmm.
That is one box which I aim to fill it up with some sensible information, not just with continuing education courses.
Yeah.
So I started shadowing at a dental lab, and I was just looking at my profile with where I can improve and everything. And I shadowed in a dental lab for about 2.5 months. I took my ADAT again, and just before Michigan interview, I gave my ADAT and I got a 510 score. It increased by 40 points. I was like,
Yeah.
okay, it crossed 500. And then right after that, I I had that was another one because I got it at the very end. I have some that reserved for that was also there. That and dental shadowing was there. I started learning Spanish. Duolingo.
Okay.
This was something else which I learned. And
Did you mention about that in your profile too?
yes, I did not say I have certifications or anything. I wanted to be
Yeah.
honest about it
Yeah.
because I just started learning Spanish. That's all, and I'm still continuing to do that. And
Okay.
I increased my volunteering hours, and yeah. So regarding the volunteering hours, which Flynn mentioned, I just want to elaborate on that one topic. So this is something for who is living in Canada. They all can apply to this. This is called as Certified Listener Society, and this is an online based. Um, how do I say? It's an organization. It is completely run by volunteers. Completely run by volunteers. So this is an organization where you so generally, this is the general thing. This is I did not volunteer. My two there are two places which I volunteered. Right, both of them are not related to dentistry. So one was this certified listener thing. This is more related to mental health more than anything, more than dentistry. So all over the world. So generally, you have people whom you are not able to express your feelings or share your feelings with anyone because of fear of judgment or what they might think or anything like that. They come to this website, Certified Listener Society. They come to this website and they just blurt out whatever they want. They just vent whatever they want. Now, I am the chat responder. I just chat. I don't talk to them. I just chat with them, but I will not judge them. I will be listening to them, whatever they type, whatever they want to say, and I'm not going to judge them. I'm not going to drop into conclusions, and neither am I going to advise them anything because I don't know their entire scenario. They might just be telling a part of the story. That's all. We don't know the entire picture. I'm just here to listen to them, and I will not also advise them on anything because I'm not a therapist. I'm not a licensed therapist. I'm not a psychologist. I'm not a psychiatrist. So for all of this, I'm given sufficient training, and I have a psychologist who is always monitoring us and helping us if we feel that we are stuck with anyone. There are people from all around the world who come in and use this website. I spoke to people from Uzbekistan, Chile, parts of Africa, Asia, India, Pakistan, Bangladesh, um, Canada, United States, um, everyone. There were so many people from all over the world. They come and they visit the site, and yeah, that is something which I continue even now, and something which I'm going to continue even further, because that experience gives me so much of satisfaction. Yes, it is online, but that increases the chance for me to actually volunteer even more. And that experience taught me so much. It actually increased the habit of listening. And as a person, I'm not someone who actually judges anyone quickly, but this increased even more with this volunteering opportunity. It just double folded. Like, no matter what, I'll just listen to them and never draw a conclusion. So that is something which actually helped me, because this is something which will help us as dental practitioners once we graduate. We never know with what stories the patients will come to us, and even if they want to share, they will share. And now over here, I had to follow HIPAA protocol. I will not talk about their stories to anyone else. Same thing will happen in our profile as well. Same thing will happen even in our profession as well. So this is something where my soft skills, or my patient management, I see it as patient management skills. That's what I took it as. That's how I took that experience as. So that is something, certified listener society, that is something which actually taught me. So Husna, if you are in Canada, I think I would actually suggest you to do that. Just keep a chocolate right after your session, because you will need it. You will need it.
That's very insightful. Do you have any other suggestions for Sanchita, Usna, and all in Canada, apart from certified listeners, like how they can seek out community service opportunities? Anything there?
Food banks, food banks are there. So if you are within the GTA area, like the Mississauga or Brampton area or anywhere like that, or if you can travel, region of Peel always has a lot. Or within your area, the region of Peel, like I belong to region of Peel, so they had a lot of vaccine of volunteering opportunities. So something like that should be popping up even in yours, because there is always something going on. Because there are elderly people might need some help sometimes. So I always get pop-ups from region of Peel saying that, phone call volunteering for elder people, because they don't have anyone to talk to. Pretty much similar, something like this. It might seem like small thing for us, but it can be very big for them, for the elder people, if you think about it. So you will create a difference. You will. So not just for putting it on the paper, but it will leave you with a lot of satisfaction too.
Harika, so with this volunteer work, like, have you mentioned this only in your CV? And are the number of hours important? Or can you just mention that you have done this volunteer work, or the time that you have dedicated that has to be mentioned in the CV or in the volunteering section of the CAPID application?
So hours need to be mentioned, the duties need to be mentioned in the CAPID application. So the best way, guys, I was just overhearing someone, don't open the CAPID application until March. Don't. I know you guys are curious. I wouldn't suggest it. So CAPID Simplified actually has a YouTube video with detailed description of CAPID application filling. So there is a video where the entire CAPID application is filled by one of the I'm not sure, I don't know her name, but she actually
Dr.
filled out.
Harika. Oh, she
Yes.
again, by the
So
way.
there was one doctor who did that entire CAPID application,
Yeah,
because
yeah.
whenever I had it out, I used to go to that video.
Right.
So I would highly suggest you that no matter what doubts you have, whatever queries you have, see that video two to three times if you really want to, because that's going to help you the most. Because whatever you need to clarify, right, everything is mostly in that way. It's pretty very clear, and what needs to be filled is also mentioned there.
Okay. Thank you so much. I have just one last question. Regarding the statement of purpose, do
Mhm.
you suggest we should get it written by someone or reviewed it by someone or do it on your own?
I have a dog. I'm sorry. I have a dog,
No
so
issue.
you can hear his house maybe maximum. I'm so sorry
Mm,
about that.
no problem. That's not an issue. Yeah, so what would you suggest? Is it better to get it written by someone or get it reviewed or just do it personally?
So SOP is something which I would say no matter with whom you make it right, because for the first time sometimes you might not have an idea. But what I would suggest is don't run away from the main purpose of SOP. Even if you get it done with someone else,
Mm-hmm.
ensure that you are the final person who's going to edit it. You took help from someone. I took it from Flynn. I got an amazing SOP from there, and that is in 2023. And in 2024, I got it done with someone else. I mixed both of them, and I made my own later.
Got it.
I made my own later because last year was probably like something which I wanted something. They actually gave me one base. I got another base this year. I mixed both and I made my own.
Yeah, got it.
Because so one thing which shouldn't be forgotten in the entire process of writing the SOP is um, it is very important to mention your story, but it is very important to connect that story and give the reason why you want to apply to DDS first and why only United States.
Okay.
You move from this point,
Hmm.
the professors will not understand why did you apply.
Got it.
They will not understand. So now that is probably the most important point you should never deviate from. And then you can always sometimes some of the best recipes are something which you can write it by yourself.
Mm-hmm.
Sometimes you might need help. That's okay. But at the end, I would always suggest you to get it reviewed by the people who got in.
Right.
Don't show it to the people who are in the process. Always show it to the people who got in, because sometimes not like you, I can say this for myself. I don't know every single part of this entire process. I know only
Mm-hmm.
a little. There can be others also in the same way, but at the end of the day, these are some of the crucial points. SOP and LOR is something which people will understand and have a concrete understanding what we need to actually at least present in it. So that I would say take it from others, but ultimately it is you who's going to decide what you are going to put it in the application.
Got it. Thank you.
No problem. Thank you.
Husna, you can unmute and
Yes.
yes, Harika.
I'll come to you, Husna. Kinjal. I'll come to you.
Yeah, yes,
Hi,
either.
Kinjal.
Yeah,
Hello,
okay.
hi Harika.
Hi, Kinjal. How
Uh,
are you?
I'm good. How are you?
I'm good. Thank you.
Congratulations.
Thank you.
And I have a question regarding like I am right now I am ready to apply, but only Colorado is left. So I'm thinking like if I apply to Colorado in this cycle, then next cycle I will be considered as a reapplicant, right? So
Be considered as a reapplicant only for Colorado.
okay, okay. So that is what my question.
Yeah.
Okay.
Yeah.
Yes.
Next year you will be applied as a reapplicant only for Colorado. That's all.
Okay. And one more question. I don't know. You are the right person to ask, but I have applied for preceptorship in Boston, which is in February. So I don't have insurance. So it is okay to ask them that
You
I
don't. You're going for a month.
no, but in their requirement, it is like you should have taken this and these vaccines and all records should be
Yeah, the vaccine records and the requirements is something which you have to, because when you're going into a university, that is the criteria which they need to file, because you are going into a different area space, and they have their protocols in which we cannot.
okay. Okay, understood. Thank you.
No, you don't need to have insurance or anything. At least I didn't have any. and nobody asked me for anything. So
Okay.
thank you. Yes, Husna.
So, sorry, Doctor, to bug you with so many questions because I feel this is a golden opportunity. We will not find a person like you to again answer all the questions. So, this is one thing that I wanted to ask you, Doctor, because I have taken ADAT this cycle and I scored uh, 10 less than 500, exact 490.
That's okay.
So as I know, 500 is a good score. So you must have met so many people in your cycle. So I just wanted to ask, what was the common? I know you guys usually don't talk about scores, but just in case, if you had any idea who scored mid 400s and got into Michigan this cycle,
I have
no.
no idea. I'll be very honest. After seeing the acceptances, that's when I got to know about the score. But as such, we never discuss about it.
Yeah, I know that's quite personal to everybody.
It
Yeah.
really doesn't matter because uh, it's very important to understand that at the end of the day, sometimes score exams can be very tricky. Exams can create a lot of stress. So it's okay. Don't be too harsh on yourself. The process is already too hard. It's definitely very stressful. Apply. You don't decide whether you are fit for the university or not. Let the university decide it. We are definitely not as much as their level. Let them decide it. That's all.
Yeah, because being a mom, family, juggling with so many things, I really have no. I gave INBDE, I cleared in the first attempt, and then I gave ADAT. The very next time, I scored 490. Now you ask me if what is my energy level for the next attempt? It's zero.
It's
It's
okay.
actually zero.
It's fine. It's okay.
Yeah.
Okay, don't be too hard on yourself. Don't be too hard on yourself. Ensure that you have a well-rounded application and ensure that, see, the best part, see, with given the level of competition and everything, what I would say is, whenever you get a chance to interview for any school, you said you want Michigan. Okay, if you get Michigan, that's the probably the best thing ever, an interview chance to interview for it. But if you don't get it, then you might be getting some other school, right? You'll be getting some other school. Just be in that mindset that okay, that's fine. You did your best to ensure that Michigan can see you. I don't know. There is no school, there is no definitive criteria that this is the reason why you got this invite. There is no school. So it is up to the school and their standards, their reasoning as to why they pick someone. We cannot fight the system. Just leave it. Whatever comes to your way, just ensure you give it your best. Because when I started this cycle, there was only one thing in my mind. I'm going to give it my best. That's all. That's all. No matter what. I just was working on my interview skills. I was working on my hand skills. That's all. And I applied with whatever I had, and and then whatever comes my way, I wanted to just give it my best. That's all. If you get Michigan, very good. Very, very good. But if you don't get it, it is not the end of the world. That is something which I would say. That's
Yeah.
Don't be too harsh on yourself. Don't be harsh on yourself. The process is very hard.
Yeah, and the second thing that I wanted to ask you was, because you had prepared your LOR, SOP, etc. with CAPID,
Hmm.
I want to openly ask you, like, or how do you think this has helped in preparing you? I believe you have applied in the second cycle, right? The first cycle you didn't get to. Is that what have been listening?
2023, 2022 was somewhere like I just applied for the sake of it. I wanted to understand what was going on, what is the cycle and everything. Me and my husband, we decided that okay, we have to try it. We have to know what actually goes on through us and in the path. Like how does the cycle actually work? What's the drill basically? And 2023, I got Michigan and NYU. Everyone got the Kira interview. Everyone got it. Whoever applied, they got it. and after that they just sent acceptances last year.
Okay,
Here,
so
this year they made the in-person candidate day as well. Last year it wasn't there. Only this year it was there. So that is why this is another thing. Rules change every cycle. Whatever was there last year might not be this year. So last year in 2023, Indiana didn't have a bench. This year, Indiana has bench. So rules change. So you cannot expect that everything is really going to be the same. And I didn't. So this time, what I ensured was I applied very, very early. Try to apply as early as you can, because the first cycle I got late, but the second cycle I just managed it really bad. Flynn knows it with the principal. I had a huge issue getting the letter of recommendation at that time.
I know.
It was very bad. But yeah, somehow we pulled off. Universe was very, very kind. Michigan just sent an interview at that time. But yeah, I did not give my best. But all I did was to ensure that I learned from that experience. That was the only thing I did from there. It was probably the most difficult moment of my life at that time, but it is something, but it is the best moment as well. I have to say that,
Yeah.
because you learn so much from it, because the professors were so amazing. It left a memory for me. So yeah,
That's nice
that's
to hear.
yeah.
So, Doctor, you started taking Caapid Simplified for preparing your paperwork, etc. in 2023. You're telling me, right? That's how
Yeah, that's why.
your journey became quite smoother, right?
Yes, so at that time, I was working with them completely, and this year I used the same LOR. I did not change the LOR, not even like a bit. SOP I changed and supplemental I changed. I'm being very honest on this profile. Flynn knows it. She knows it. I had this discussion before, but LOR I did not change one bit, not even a bit. The same thing just moved forward, and yeah, so SOP, I took that as a base. I told you, right? I mixed both of them and I made my own. So at that time, so that's what happened. And but overall, no matter what, after that, 2024, I applied and I finished everything by April first week. Probably, this cycle actually felt like this is my first cycle, because I actually did everything on time this time. Everything went by like on time this time. So everything just fell into place. It felt right as well. So and then right after the applications went through, I started preparing for my hand skills. That's all. And then yeah, I used to ask my friends, my doctors, all of them to help critique. And then I got my interview for Nourah, and then after that came Michigan, and then came Pittsburgh. These three were the interviews I got this year.
Sorry, which interview did you get first? Loma, Linda,
Nourah.
Nova? Okay, okay, okay.
I gave it. Nourah was there, and then I got waitlisted for that. Then I gave Michigan. I got waitlisted for Michigan as well. And then what happened was, after that, um, God's grace, the waitlist moved, and then I got accepted. Then I said no to Pittsburgh, because I got Michigan because someone else just moved somewhere else.
Mhm,
All I did was they get in a place where they like. That's all. And I got it because someone else left. And if I just pass it on, probably it can make someone else's day. So yeah, that just passed on. That's all. So me and my husband collectively, we were there for it. We were in for it, and we wanted one school. We got one school. That's all. Yeah.
Oh, amazing.
That's
That's beautiful.
all. We got. That's all. And yeah, Pittsburgh. That's a bit. That's about it. Yeah.
Doctor, there's one last thing I'd like to ask. Doctor, did you add all your Indian dental experience or whatever you've done in India in your CV too?
Yes.
Okay.
Yes. Yes. I worked hard for it. Yeah, I did. I have to add it. Yeah. So I did
Okay.
all of it. Yeah.
Okay, that's nice. Doctor, do you have any idea about like there is online volunteering experience in Canada here, like what you told me?
Mhm.
So is there anything in US that you have ever heard of, like
Yeah.
online, just like this? No?
If you know anything, please put it over there. But
Like
I,
the only thing I know is Red Cross and nothing else.
I would always suggest do what you have in your hand.
Yeah.
Volunteer is one thing which you see. Volunteering is an act where you give back to the society where you're living in. If you see it that way, just do it because you want to do it, and and automatically you can put it. You will be able to fill up the duties and everything on your own much more beautifully. So you have a lot of shelters, dog shelters, or food banks, so many places to see, to go to, and world always
Yeah.
needs more people. That's all. Go ahead.
You can also check Volunteer Match online if you haven't, Husna. There's a website called
Okay.
Volunteer Match, and that has proved useful to some people. So you put your location and all that, and they'll show whether there's any volunteering opportunities in your locality or around you where you can go. So that could
Okay.
be probably, and the best way is just walk out and check in your locality as well. So whichever works.
Okay,
I'm
that's great.
going to play the bad cop here. I'm sorry, but it's say we are a bit over time, so we'll take the last four questions,
Okay. Okay.
last four raised hands, and even though there were others waiting, let's go with Dr. Mihir Patel because I think he didn't get a chance to talk, and then come back to the other three doctors. I mean, other two people on the list.
Thank
Here you can, yeah, unmute and
thank you
speak.
so much, ma'am. So, doctor, I want to ask about the experiences. I do have experience in US as a dental assistant for 3 years, and I also work like few months as a dental manager as well. And right now, I'll get the license as a dental hygienist in Florida. So I'm
Congratulations.
planning to get the uh, start working as a hygienist. But when I was doing my MPH, I work as a pharmacy intern for 2 years. So can I add that experience in the?
Anything and everything you do, you have to enter it. You can enter over there, and you can tell what you learn from there. So see, every experience need and always be related to dentistry. So as I told you, my volunteering experience actually made me learn people skills, and help me how to attend to people no matter what situation they come up with. So you will learn something from there.
Yeah. And should I still considering giving a ADET exam or?
See, that's a choice which you have to make. For me, I wanted to write it and I gave it, but sometimes it needn't be necessary. There were a lot of students who, in the interview process over here, in uh, um, who came to interview with me who didn't have it. That that's okay. It's fine. There's nothing like that. Never stop applying to any university just because you feel that you don't have it and they're asking for it. Ensure that you meet the minimum criteria first. This is the golden period right now. Right now, from October to March 1st is the golden time period where you can actually improve your application. Ensure that all your paperwork is ready. Ensure that all your supplemental application is ready. Ensure that all the paperwork is ready, because right after that, ensuring that your letters of recommendation are there on time, and you check all the universities and you check what they need. Now see, Buffalo and NYU have some criteria for TOEFL guidelines. You
Mm,
have to check that.
okay,
So you have to keep checking if they are being met properly or not. You'll have other things to take care of.
okay,
It's the time when you can actively ensure that all that paperwork is done. You have 4 months.
okay,
Do one application in 1 week.
okay.
You
Thank you,
have sufficient amount of time for that.
thank you, doctor.
Who was the Dr. Harshita? No, Sushti, Dr. Sushti. And then Harshita, you can go next.
Okay.
Hi, doctor. Thank
Yes.
you for today's this conversation.
Yeah.
I have couple of questions. First is regarding this reapplication thing. does this reapplication count? So if I apply for a cycle, if I'm not getting, this reapplication is a big thing, or it's like it's okay that if I'm attempting again and again, like 2 or 3 times, if I have to.
So, some of the universities do not like reapplication. One is Rutgers. That is something which I know for sure that they don't like reapplicants. Rest, I would, most of them would be okay with reapplicants, because you know why? What I got to know recently was Boston had 3,000 applications this year.
Mm-hmm.
Boston alone. Now, 100 seats. Now, 2,900 people will be told no. Think about it. They will reapply, right?
Yeah.
So, what I would say is, first thing is kudos to you. A lot of courage is needed to actually reapply. It's very difficult to explain that stress for anyone who's going through the reapplication. What I would suggest you to do is these 4 months, just ensure that your paperwork and everything is on time, and to talk to your recommenders and ensure that that the letters of recommendation will be reaching the CAAPID portal as soon as possible, and check with all the universities the minimum requirements, whatever supplemental application they need, whatever needs to be filled, ensure that you fill it up before itself and keep it ready, and and apply as soon as you can, so that that will actually give you some peace of mind, and will actually help you to focus your mind on interview skills and hand skills,
And
because
sorry, yeah, continue.
and apart from that, you can also update them, like if you feel that that you want to update some aspects. Now you might now while you're doing the course, for example, I'm just saying for the sake of, like, just giving you a reference. Now you go to Stevenson, the coaching center for getting your hand skills bench test preparation course done. Now after that is done, in probably if you take it in April, per se if you take it in April, then right after the course is done, you update all the universities saying that this is something new in my profile. Please add it to my profile. Please add it to my profile, and please review it. You can actually send it. That will help you. You will actually get some time. So as a reapplicant, just utilize this time. Add something. That box which is there, which asks you, what did you improve from last cycle to this cycle? Just focus on doing that, and just move ahead. All schools interview skills. Whatever you get, just nail it. Whatever school you get, just nail it. Leave the rest to the universe. It's going to take care of it. Trust me.
Okay. And for this, so you said in 2022, you just was going through with the applications, and that was your. So I'm also that kind of person that I want to know what's going on, and then I'm like, okay, I know that these things I needed, and then I will be do it. So did you change in your next cycle your LOR also? Because that is that we have to ask our principals, dean, and also, is it the same LOR? And it's okay. Right? Like,
Ensure that your LOR all, like, see, ask your recommenders to mention as many references as they can to actually show that you are an able dental professional. Because if the more your recommenders actually give references, the more it will be better. Because that actually, like, that will actually give, ask them to that's something which will help the most. That's all.
because I heard that every cycle or every year I have to change my LOR. They won't gonna allow the dates on the LOR. I have to change it.
Yeah, you have to. That is something which you'll have to ask them if they want to change it, and then if they want to add anything to it or take out anything to it, ask the recommenders, because that is something which we cannot do, right? You have to ask the recommenders to do it. And the recommenders, when they send it, if they want to change anything from it, they can change it, but ask them to change the date. If they feel that they don't want to add anything else to it, they can just change the date and they can just upload it in the portal. That's all.
Okay, so
Because
it's just the date. And the last question.
if they feel that they don't want to change anything else, then yes, the date. Because keep it as latest as possible, but it will be a fresh LOR for sure.
Okay, and this would be my last question.
Yeah.
And what would you suggest to do everything for take a sit back, take a year, and give all the certificate exam like RDA and sealants, infection control, all the exams like fluoride hygiene and everything, and then apply? Then we have a more chance, or I can start applying if I'm not getting into this cycle. I will apply next year, but that time I have the certification extra.
So see, you can always apply to the schools and you can send them updates. They should be meaningful updates. You cannot send them an online CE course and send them that this is an update to my application. If you have something like sealants or RDA, RDA license or something like that, they are meaningful updates. It means that you have put in the effort to actually learn more and try to actually understand how dentistry works in North America. That is something which the professors over here want the students to know, because we, as someone who are coming from different countries, we the number one attitude which we need to have is, first thing is, should be incredibly positive towards whatever process it is, no matter how negative it is, and say that it's okay, I can do it, I can do it, I can do it, it's okay, no matter what is thrown at me, I am going to take it and I'm going to learn from it and I'm going to do it. That is one positive attitude which can attract a lot of good around you as well. And something which is making you mingle into the system will give them the confidence that you will be able to face any patient with confidence. And all your certificates, your sealant certificate, your RDA certificate, your radiology certificate, you said hygiene as well, everything is going to prove that you're trying and working hard to get into the system and learn how it works.
Okay. So I should.
That's okay. You apply to the cycle. Never stop applying to the cycle. You can send them updates, but you will have to send them individually, because the first time when you actually submit everything, that's the only time when everything goes at once. But after that, if you add anything, probably you'll have to send it individually to every university. That I added this in my CAPID application. They will take what is actually submitted in the CAPID only, because that's something which is verified and everything, and or whatever it is that will be pasted over there. So ensure that you are able to do that.
Okay.
And update them individually. I think you will have to update them individually. Yeah.
And can you just, I missed the name of that doctor which you said the CAPID video, the whole
That's
CAPID.
Dr. Nikita. Dr.
Sorry.
Nikita. Dr.
Okay.
Nikita. I can send the link here. Just like give me
Yeah.
5 minutes. I'll send it on this
Yeah.
chat.
Yeah, thank you so much.
It was my
She
goal.
wa- Yes, I'll send it here. She was also in Michigan. She was with before she applied. She made that video. Then she just graduated last couple of months back. Now she's practicing in a private practice.
Wow.
Yeah, I will send that here. And while again going back to wrapping up the call, let's go to Dr. Harshita and then
Yeah.
Dr. Sanchita as well. I think you raised your hand, right? We can clear the questions with that. Yes, Harshita, go ahead.
Yeah, Harika, my question was actually that what you just answered, that if you're applying early to the applications and then you make progress in the following months, can we send the individual updates to schools?
It should be
Like,
a meaningful update. You cannot send an
yeah,
online course, as I said. That's all.
right. And second question, do you is there a word count for the letter of recommendations? Do you suggest to keep it simple
One,
and short, or whatever, extensive?
keep it one page A4 size sheet.
Okay, sure.
That's all.
Thank you. Yeah.
Thank you.
Before we go to Sanchita, just to add on a little bit on the LOR, earlier someone asked about changing the letter, right? So I wanted to add on to what Harika said. The one kind of letter where you might want to push a recommender to alter it is of the person who's working with you right now. Imagine you applied in last year's cycle and you gave the recommendation from a US letter, US dentist. And this year also you're working with that person. So obviously something has changed in the last 1 year, right? Some
Yes,
incremental like knowledge improvement. So you
yes,
definitely want to add that on. So relevance, you look at that. The dean and professor will not have anything to say about you again more. So just
yes.
keep that in mind, and then yeah.
Thank you, Flynn.
Yes.
Sorry about that.
Yes. Sanjita, go ahead.
Yeah. Hi. So I just had two questions. The first one was, I know that you said that don't go into doing anything just for the sake of a CV, but I wanted to know how important or how valuable it is to have a preceptorship on your CV. And the second question, I wanted to ask you if you have any tips for the ADAT exam.
So preceptorship was something which the that was probably the option I had at that moment when I was searching as to how do I actually gather some more experience to actually understand US dental experience at that time. If you cannot do it, there are other options like conferences is one thing. Externships are something which you will have to go to every single website and check if they are offering or not, and if they are doing it, what are the conditions to it, what are the requirements which will actually make you qualify for it, which universities are able to give it to foreign trained dentists. If you are able to qualify them, I would say go ahead for it. See, the basic goal is to actually understand how does a school work, or how does dentistry work in North America as a whole, and keeping that as a goal, you can just go ahead and get whatever experience you want. And coming to ADAT, mm, coming to ADAT, write it only if you want to. Write it only if you want to. I mean, I had a, I went back to reading biomedical sciences and everything. So yeah, it was fun for me, but yeah, it totally depends.
No,
It
because sorry,
person.
but I am living in Canada at the moment, so I'm planning on applying to University of Toronto as well. So I
Okay.
thought I'm writing the ADAT either way. And I also want to know if, since you also lived in Canada, if you know of any programs in University of Toronto that might help.
No.
Okay, thank you.
No, I totally ensured that I focused on only one thing, and I put my energy to it. I
Okay.
was After a point I was not able to divert my energy. I just was able to, I did apply initially, started my process with this, but totally I ensured that I was creating overall profile, and I was trying to ensure that my Caapid profile is really good and focused fully on it. So yeah, because I wanted to focus on only one thing and do it right. That's all. That's all. That was my goal. So yeah. Yeah, and Aditi, so actually Flynn mentioned one, she's gotten a really good score, so you should be able to ask her. She's someone who actually wrote it from India directly, and she's someone who got got a very good score. Yeah, that's something
I
you can
think
know.
Sanchita might have seen this blog, right? Yeah, I was
Yeah,
also
I
sending
did.
it for the other. And but yeah, anytime I get to connect with Aditi, I'll definitely patch her through. But she's busy with NYU classes now, but maybe in the next coming month. Um, Husna, I am taking the liberty to not unmuting. I'm really sorry, but we're way over time. One last question, my Husna, which I'm assuming, Harika, you can quickly answer is which dental lab did you volunteer in Canada? Which is something I think they want to even take the name and go there.
Give me one moment.
Awesome. And anything else that while Harika is looking at that, if you all have any questions, you can either email us and we'll definitely pass it through to Harika. And also, we have more sprints coming up, drills coming up with other students. And
Yes,
did you find the name, Harika?
Care
Yes, you
Dental,
can go ahead.
Care Dental Lab,
Clear Dental Lab,
Care.
Care Dental Lab. Okay.
Care Dental
Was
Lab.
very kind enough. I actually knocked many doors, and he was very kind to actually let me shadow him.
Awesome.
Very,
I
very
hope this is
Dr. Mr.
in
Steve
Canada.
Steve Pontet, I think. I don't know his last name. Steve was a person, but amazing guy, very, very kind. Yep.
Awesome. And with that, I think we will wrap up this drill. But I think this was very more engaging than I thought it would be, and I'm really glad. I think both Harika and all of you, applicants who are here. I have 4 videos on throughout the 4 or 5 throughout the drill is not something we always see. So whenever we see that, we're extremely happy. And just to sum up, I think the main takeaways from Harika is that just keep doing what you're doing. Look at this as a long-term process. Even, I mean, and when you feel low, you will feel low at some point. You just
Yes.
have support around you. I remember
Yes.
Harika always had her, I mean, of course, her family and her partner, but also every call that we had, she used to have a dog with her. And I remember her telling me that this is her. I know it
No.
sounds like a very small, silly detail, but it is
No.
important to have your support
Yeah.
system
Yes.
and keep going.
My family is my pillar, because of which I
Yes.
could come until here. My husband, my in-laws, my dog, my parents, everyone, my professors, everyone. We cannot do this journey alone.
Yes, you
So
can. It does take a village. And if you
so
don't have that village immediately around you, please seek out your friends, like go to people,
yes.
talk to them.
Yes, yes.
All right?
Don't be hesitant. Don't be hesitant. Sometimes, even if they might not have an answer, you might, while you are speaking out, you might automatically get the answer by yourself, and then you'll
Yes.
immediately be like, okay, this is what I'm supposed to do. And because you don't want to waste time by yourself, no one willingly wants to just waste a cycle by themselves, right? So yeah.
Yes, that's
So
right.
don't worry. Be brave, be positive. There is light at the end of the tunnel. Always. Trust me. That's all. That's all. Universe is listening to you. Just let out the positive energy outside. That's all.
Yes. And apply to as many schools as you can, as much as
Apply
your
early
finances
as
help you.
possible and as many as possible. You don't decide whether you're fit for it or not. Let the university decide it. If the university wants to reject you, let them reject you. But you don't decide that. That's all.
Awesome.
Okay.
Have a good night, guys. I am assuming you'll be dreaming CAPID at this point and ADAT. But as long as you've gotten the information you want to, that's great. And if you guys have anything to ask us or ask Harika, email us and we'll patch it through to her. All right. Thank you so much for joining. Have a great rest of the night. And it's a long weekend, right? So have fun with that.
Yes. Happy Thanksgiving, guys.